My name's Amy Lorio. I'm the Program Development Manager for Bridging Brighter Smiles, and we've been in the Wausau area since 2012. So we're a mobile dental hygiene company. We serve school-age students from pre-K to 12th grade. We provide preventative dental services such as screenings, cleanings, fluoride varnishes, sealants, silver diamine fluoride. We also do oral health education and referral assistance for families. Just this year, we've had a little under 2,000 students enrolled in our program. We have Stratford, Edgar, Athens, Spencer, Wausau, DC Everest, Marathon, and Mosinee, as well as Newman Catholic and the Marathon County Head Start. So over the years since 2012, we've served tens of thousands of Marathon County students. We are a Medicaid provider, so everyone who has Medicaid receives our services at no cost. In some cases, based on need and financial capacity, we're able to donate our services charitably. Otherwise, we charge nominal fees, much lower than you'll find in any brick and mortar clinic. So we're looking for funding to purchase 4 portable x-ray machines. They're about the size of a hairdryer, to be able to take dental x-rays of students in school during the school day. We're also looking for funding to help support a salary for a dentist. We will need a dentist on staff to review these x-rays and make diagnoses. Dental hygienists cannot diagnose. So having a dentist on board is incredibly important for the success of this project. Otherwise, we're just taking x-rays and we're not really doing anything with them. They would be able to go through the x-rays and along with the clinical notes that the hygienist sent over, be able to make diagnoses. And with these diagnoses, such as, they've detected early onset tooth decay, we can treat that early onset tooth decay ourselves using what's called silver diamine fluoride. For cases that are more severe, we can use those x-rays and the clinical recommendations of the dentist to send a very informative referral to an outside clinic to perform things such as fillings and crowns and extractions. We are requesting funding for 4 mobile x-rays, and then the second would be the dentist salary. We have 4 teams working the Marathon County area. So we'd like to have each of our teams have their own x-rays. They'll be going into schools every day taking x-rays, so there's no way we can share between the clinical teams. We had one kiddo who had been suffering from what her family thought was an ear infection. She had an earache, but they would go to doctors and no ear infection, so they weren't really sure what to do. The kiddo was enrolled into our program, and the hygienist noticed an abscess on her gum way in the back of her mouth, and we were able to work with the families and the schools to get this child referred out and treated, and that actually cleared up the earache. So that kind of shows you how integral oral health is with overall health and well-being. Tooth decay causes pain, problems with speech, problems with concentration. It lowers school performance. It causes more missed school days. So just taking care of tooth decay and the problems that it causes can really help a student do better in school, that help them show up and concentrate. It's unfortunate, but many children, their families can't get them to see a dentist. They're on Medicaid. They can't find a Medicaid provider. They can't find one who doesn't have a wait list like 8 months long. So they end up turning to emergency departments for tooth problems. And emergency departments are not equipped. They'll usually just send them home with some antibiotics. And then they'd have to, take the lower reimbursement, the Medicaid reimbursement for high cost quality care. So it puts stress on the healthcare system. It also puts stress on the family to have to take time off work, which they can risk losing wages if they have an hourly job, find and arrange transportation and childcare to try to get their child in to see a dentist. For a lot of them, dental care is a luxury, and it shouldn't be a luxury for, especially not for children. So this, by adding to our service offerings with these x-rays and teledentistry, we can catch all of these early onset cases before they develop to a point where they have to go to the emergency room, where they have to take time off work to get their kid in to see a dentist to treat something that could have been prevented if we had seen it earlier.